Empagliflozin, cardiovascular outcomes, and mortality in type 2 diabetes. Backgrounds. The effects of empagliflozin, an inhibitor of sodium glucose co-transporter 2, in addition to standard care on cardiovascular morbidity and mortality in patient types 2 diabetes at high cardiovascular risk, are not known. Methods. We randomly assigned patients to receive 10 milligrams or 25 milligrams of empagliflozin or placebo once daily. The primary composite outcome was death from cardiovascular causes, non-fatal myocardial infarction, or non-fatal stroke, as analyzed in pooled empagliflozin groups versus the placebo groups. The key secondary composite outcome was the primary outcome plus hospitalization for unstable angina.
Type 2 diabetes occurs when your pancreas does not produce enough insulin, and your body is resistant to the insulin that is produced. Insulin is a hormone that helps your body use blood sugar, known as glucose, for energy. Your body takes the food you eat and breaks down fat, protein, and carbohydrates for energy. During the digestion process, the carbohydrates from your food are broken down into glucose. Glucose is absorbed into the bloodstream where it is carried to cells throughout your body. A healthy pancreas releases a regular supply of insulin into your bloodstream. After you eat, your blood glucose levels rise, and your pancreas responds by releasing more insulin to move the glucose into your cells. Insulin acts as a key, opening up the cell so it can accept the glucose. In a person with type 2 diabetes, your insulin receptors are less sensitive. Though your pancreas continues to produce some insulin, it is not enough to meet your body's needs. When your body's cells are less responsive to insulin, it is more difficult for glucose to enter the cells and raise your blood glucose level. As a person with type 2 diabetes, it is important to monitor and maintain healthy blood glucose levels. Over a long period of time, high blood glucose levels can lead to serious health complications such as heart attack and stroke, blindness, kidney failure, and nerve damage. By getting daily physical activity, eating a healthy diet, and taking your prescribed medication, you will decrease your chances of developing complications from diabetes.
Results. A total of 7,020 patients were treated. The primary outcome occurred in 490 of 4,687 patients, 10.5%. In pooled empagliflozin group in 282 of 2,333 patients, 12.1% in the placebo group. There were no significant between groups difference in the rates of myocardial infarction or stroke, but in the empagliflozin group there were significantly lower rates of death from the cardiovascular causes, hospitalization for heart failure, and death from any causes.
The EMPA-REG outcome study was a study designed to assess primarily the safety of empagliflozin in patients at high risk of cardiovascular disease. So the study had a goal of showing that empagliflozin was safe and did not increase cardiovascular risk, but at the same time it was designed to look at whether there would be any benefit of giving this drug to patients with cardiovascular disease. Did it reduce mortality and cardiovascular events such as myocardial infarction, stroke, and heart failure? Patient population were patients with type 2 diabetes who had a hemoglobin A1C of greater than 7%, who also had cardiovascular disease, and that was defined as a prior heart attack, triple vessel coronary disease, or single vessel coronary disease with evidence of provocable ischemia, or they had a prior stroke, or they had peripheral vascular disease. They had to have a creatinine clearance, an estimated glomerular filtration rate of greater than 30, and they couldn't have a body mass index of greater than 45. Empagliflozin is a sodium glucose co-transporter inhibitor, and it blocks the uptake of glucose by the proximal tubule in the kidney. So it blocks both glucose and sodium uptake there. So it increases glucose, it causes glycosuria. So the patient passes glucose in their urine, and it's the glucosuria which the excretion of glucose which results in glucose lowering and glycemic control. They're quite powerful agents. In fact, they lower blood glucose more than the DPP-4 inhibitors, for example. So the use of these agents is in all patients with type 2 diabetes who have adequate renal function. So they have quite a wide application. Primary results the primary endpoint was what we call triple MACE, which is a major adverse cardiac events, which included cardiovascular mortality, non-fatal myocardial infarction, and non-fatal stroke. And there was a 14% reduction in this primary endpoint, which was statistically significant. This is the first glucose lowering trial which has shown a definite primary endpoint reduction, statistically significant. The primary endpoint of the triple MACE was driven by a 38% reduction in cardiovascular mortality, and that cardiovascular mortality was one component of all-cause mortality, but all-cause mortality was reduced by 32% with no reduction of non-cardiovascular mortality. The take-home message is that we now have a glucose-lowering agent which in patients who have cardiovascular disease saves lives. In addition to saving lives, it reduces hospitalization with heart failure, both in patients who had a prior history of heart failure, but also in individuals who had no prior history of heart failure. And heart failure is a very common event in patients with diabetes. First of all, 40% of patients with heart failure have diabetes, and up to 20%, particularly in populations of patients over the age of 65, will have some degree of heart failure. And then abnormal cardiac function, particularly diastolic function, is very common. And there are studies suggesting that up to 50% of patients with diabetes have abnormal relaxation of their hearts. Adverse effects of this agent are very few. The most common adverse effect is genital infections with yeast species. Glucose around the genitals is often associated with yeast infections. However, this can be minimized by good genital hygiene. But in addition to that, in the EMPA-REG study, there was about a 6% excess of genital infections, but only 1% of patients had to stop the drug because of this. So it was a very low, and no other side effects. So, for example, there was concern about fractures. We did not see an excess of fractures. We did not see an excess of urinary tract infections. We did not see an excess of diabetic ketoacidosis. So a very safe agent with a relatively minor side effect which can be minimized.
There was no significance between group difference in the key secondary outcome. Among patients receiving empagliflozin, there was an increased rate of genital infection but not increase in other adverse events.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cells. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination and excessive thirst. Other symptoms include weakness, drowsiness, and blurred vision. These are caused by chemical imbalances in the blood related to high levels of blood glucose. About 1 in 4 people with type 2 diabetes are unaware that they have the disease. It is important to catch diabetes early. Over time, high blood glucose damages the blood vessels, which can damage the organs that these vessels supply, leading to a variety of health complications. Damage to the small or micro blood vessels can cause vision problems, including loss of sight, nerve damage, and kidney disease. Damage to larger or macro blood vessels can lead to cardiovascular complications such as heart disease, stroke, and poor blood circulation. Overweight and inactivity are major causes of diabetes. A family history of diabetes significantly increases your risk of developing the disease. Certain ethnic populations are also at increased risk of developing type 2 diabetes. Finally, some medications may increase your diabetes risk, specifically corticosteroids, thiazide diuretics, drugs used to treat certain mental illnesses, and some antiretrovirals used to treat HIV infection. In summary, type 2 diabetes is a metabolic disorder. It causes sugar, in the form of glucose, to accumulate in the blood rather than being used as fuel for the cells in our body. If not diagnosed and treated in a timely manner, type 2 diabetes can lead to many health complications.
Conclusions. Patients with type 2 diabetes at high risk from cardiovascular events who receives empagliflozin, as compared with the placebo, had a lower rate of primary composites, cardiovascular outcome, and of death from any causes when the study drugs was added to standard care.
Type 2 diabetes symptoms. Diabetes warning signs. Type 2 diabetes symptoms worth knowing. Any of the following warning signs could be one of the type 2 diabetes symptoms. You could experience one or more of the following diabetes signs or symptoms, or you may not experience any early symptoms at all. A great number of folks never experience any symptoms of type 2 diabetes and are surprised when they are diagnosed by a routine blood test during an annual physical. Type 2 diabetes symptoms can be rather vague, such as being more tired than usual, or always feeling hungry between meals and craving sweets for a pick-me-up. These diabetes symptoms could be written off as stress or blamed on a demanding job. These early diabetes symptoms attributed to diabetes are more constant and pronounced than merely reaching for a couple of cookies occasionally between meals or being tired after a hard day. 10 Type 2 Diabetes Symptoms Checklist. Increased hunger and craving sweets. Extreme thirst. Frequent urination. Weight gain. Fatigue and drowsiness. Blurry vision. Slow healing wounds, sores, or bruises. Dry, itchy skin. Tingling or numbness in the hands or feet. Frequent or recurring skin, gum, bladder, or yeast infections. One of the specific symptoms of type 2 diabetes is having patches of dark, velvety skin in the folds and creases of their bodies, usually in the neck or armpits. This condition, called acanthosis nigricans, may be a sign of insulin resistance. Type 2 diabetes rates are growing dramatically in the United States and Western Europe. Type 2 diabetes is a slow progressing disease that begins a long time before the actual diabetes diagnosis. Type 2 is the result of the muscles and other tissues of the body developing a resistance to insulin produced by the pancreas. Initially, the pancreas tries to overcome this resistance to insulin by making more insulin. The blood sugar level goes up as a patient's body is no longer able to make enough insulin to counter-react the gradually increasing insulin resistance. This form of disease generally strikes the over 45 age group, although younger ages can be affected. In comparison, type 1 diabetes results from an autoimmune reaction in which one's own body attacks and destroys the beta cells of the pancreas. These are the cells that normally produce insulin. Type 1 diabetes is a disease in which the patient in a relatively short time has no insulin production. Since type 1 diabetes often strikes children, this form of disease is commonly referred to as insulin-dependent or juvenile diabetes. How develop type 2 diabetes symptoms? Keep in mind, type 2 diabetes symptoms develop slowly and are usually produced by weight gain, especially in the abdominal region. Think apple-shaped body. Obesity and lack of exercise are closely linked to type 2 diabetes. Type 2 diabetes is generally preventable. If you are over 45, have an apple-shaped body, and have a family history of diabetes, talk to your doctor about proper diet, weight loss, and an appropriate exercise program. Taking preventative action can help you avoid type 2 diabetes symptoms.
Thank you.